All right, good evening, everybody, and welcome to Glendale City Church Online and to the beginning of what I'm hoping is going to end up being a weekly tradition of bringing on somebody who knows what they're talking about to speak to issues related to our journey through COVID-19. And 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 the benefit is a number of the people I'm reaching out to to look at this are people within our congregation. We're fortunate to have a robust group of people who are knowledgeable and skilled and are actually engaged with things going on at this time. So anyway, watch for information on our social media platforms, on our website, on our church app. We're hoping to have weekly gatherings coming up. But what got me going on this idea was when I started refreshing my memory that we have an epidemiologist who's a part of our faith community. And so I'm grateful that Alex Dubov can join us tonight. He's a professor of public health and Christian ethics at Loma Linda University. And we're grateful that he set aside his time to share with us his perspective and expertise on the latest developments related to COVID-19, and then answering any questions that you might have. So what we're going to do is we're going to start off with Alex giving us an overview of the latest information that he has, and then as he's talking, if his presentation raises questions that you want to ask, please type them into the chat box. We're not going to have audio on. We're going to keep everybody muted throughout the presentation tonight. So please send your questions to Alex via the group chat. And after his initial sharing, we'll begin to work through the questions that you send in. So Alex, again, thank you for being here, and go ahead and share with us what you're seeing and learning and what you think is most important for us.
Right, yeah, well, first of all, I'll start with saying that maybe a few words about my background. So my background is in public health and medical ethics, so PhD in medical ethics, but I'm trained in public health as a postdoc at Yale. Mostly my work was with HIV, so I still work, still have grants, write papers on HIV prevention and anything related to HIV. So so that's the extent of my knowledge working in public health, working with HIV. So I, by virtue of this, I'm trying to keep updated on latest developments also with COVID. Even like the center that I work with at UCLA, Center for HIV Prevention and Treatment, now with COVID, we're switching to work related to COVID. All the researchers now trying to move into this area because there is so much need. So we're trying to learn as we go. And the information I can share, it's what I learned, it's my perspective, so I'm not representing Loma Linda in any way. I hope I'll be able to cover some, maybe I'll start with basics, and then we can ask me questions as we go. So I thought we'll start with basic things like understanding this virus, what it is, how contagious this is, the virus, how it infects somebody's body, how deadly it is, what kind of symptom it has, how we can control and prevent the spread, and how long the pandemic will last, which nobody really knows, but I can tell you what I've seen. So first, obviously virus has a lot of names. So it's coronavirus, COVID-19, SARS-CoV-2, SARS. So it's all the same names for the same virus. It's RNA virus. It contains RNA inside that can reproduce. And outside, it's contained in a capsule with spikes. You've probably seen the pictures. That's why it looks like a corona, and that's why it has the name of corona. It looks like a crown. So coronavirus. It's first appeared in China in 2019, so that's why COVID-19. So COVID is basically coronavirus infectious disease 2019. So it's a short name for this. And why SARS? Because it's a second generation of SARS viruses. and it's helping us to, since we know already something about SARS, it gives us a head start to understand this virus. But it's important to know it's different from SARS. It's we've never been exposed to something like this, so it's a new new virus that's similar to SARS but second generation. So how contagious is coronavirus? It's way more contagious than SARS. And it's different from SARS in a way that, if you remember SARS, it was more of endemic where, was it limited to 20 something countries. Now we have coronavirus in 157 countries, I believe. And so this is a pandemic and it spreads very rapidly. So the speed of spread of coronavirus is about 2.6. So basically it's a spreading factor. So one person can infect on average 2.6 others. And usually when we talk about infection rates, we talk about exponential numbers. People have a hard time understanding exponentials. But for example, let's imagine there are 5 sick people. There was a nice kind of picture illustration. I think New York Times published this as well. So in 2 cycles, so basically these 5 people go into the community, they have potential to infect 18 other people. In 3 cycles of reinfection would be 52 people, in 4 cycles of 140, in 5 cycles 368. So that's how the curve goes up really quickly. The more exposure, the more people can infect others. So it spreads very rapidly, and that's why we talk a lot about flattening the curve, isolating people, trying to prevent spread. And so that's why we need to do everything we can to prevent the spread. So how deadly is the virus? So the current mortality rate is about 3.7%. From what I've seen. And it's important to remember the data, or keep in mind rather, data from China. Basically, most of what we know about coronavirus, it comes from Chinese scientists. They were amazing in putting out a lot of information that's very helpful. And they were also amazing in the response to coronavirus. So what we know from China, it's about 81% of people develop mild symptoms. 14% develop severe symptoms, and 5% develop critical symptoms. So basically what it means, 81% of people may not need to be hospitalized. It's different from flu, so it's severe disease, but maybe there will be no need for hospitalization and or ICU. For 14% in potential there will be needs for hospitalization, and 5% will probably end up in ICU for sure. So that's what we know about how much it affects people. Usually it affects more people who are older. You've obviously seen this, it's 65 plus, but also it affects people with underlying health conditions. So people who have cardiovascular diseases are more predisposed, diabetes, people with chronic respiratory diseases, so COPD, asthma maybe, cancer, people who have cancer. So basically, if you have chronic disease, the chances are, you're more predisposed to, more vulnerable to the virus. And so basically, what happens with this virus, remember that it has kind of spikes, right? So in our body, we have, in our lungs rather, we have ACE receptors, also ACE2 receptors, and they're there usually to protect our lungs. It's a very basic explanation. So they're the first port of entry for the virus. The virus connects with the ACE receptors, so launches onto them, and then it enters the cell and uses the cell as a factory to reproduce in the body. And usually why we have, for example, those 14 and 5% of people who develop chronic conditions, it's what usually happens. We see it on the CT scans, like it's a fibrosis, this ground glass effect in the lungs, basically scar tissue scattering the lungs, because virus takes over the lungs, reproduces, and it produces fibrosis, and it leads towards acute respiratory distress syndrome. So basically, there is so much fibrosis, there is not enough oxygen in the lungs, they're not pumping enough lungs. That's why people end up on needing the ventilators, and that's why we worried about ventilators and capacity to address the disease. About the symptoms, you probably know that symptoms, mostly it's a dry cough, fever, that's main symptoms. And some people have, so it's a fever and cough, dry cough. Two main symptoms. Some people also have myalgia, so basically body aches and headaches. So that's the main symptoms. And remember again, so for some people that will be the extent of the virus. For many, for almost to 80% of people may end up with this kind of symptoms, with maybe high fever, but may not require hospitalization. But the worry again, we have this 19% of people who may need hospitalization and ICU support and ventilators. And the current projections, I don't know if you've seen, there are many different estimates of the extent of, or how many people will end up being infected, but they range in between 75 million to more. So if you think about 20% of that, it's still a very high number. That's why we very worried about overwhelming the healthcare system, and we're trying to do everything we can to flatten the curve, to make sure that we prevent all this number of people who may end up needing support at the same time. If you remember or if you've been to the stores, and you've seen how people fight over toilet paper or some resources, imagine if that will happen, but in healthcare, where people will not have enough support. So that's the reason why we, if you see all these measures now, where we have to be staying inside, and it may seem that it's too restrictive or severe. That's the reason why we're doing it, because there will be no capacity to address the virus. I mean, to address the people who will need support. Ways to prevent or control and prevent the spread, it's basically try to maintain social distancing and practice it. And remember that social distancing is not, it's more of a physical distancing. You don't have to separate yourself from everybody else and lock yourself in the room. You can still go outside as long as you maintain a distance of about 6 feet from people. Make sure that you wash your hands, sanitize your hands. Sanitizers work if they have more than 60% alcohol. Washing hands is also probably the best way to wash hands, because if you remember, I said that virus has this kind of envelope, and it's in a way, it's a greasy envelope, right, that sticks to your hands. If somebody coughs, or if it also lands on surfaces, and the ability of soap kind of lifts that, that greasy envelope of that virus from your hands. So it's, that's why we also talk about, it has a surface kind of surfactant properties. So that's why we talk about washing hands for 20 minutes very thoroughly. No handshakes, no contact with people. That's if you can avoid contact, avoid social gatherings, right? In terms of what kind of treatments we have now, then there is a difference between treatment and vaccine. So while we trying to look into treatments, meanwhile, to develop something that potentially may block the virus or may help with symptoms, the only real treatment is a vaccine. the good news that we had yesterday, I think I've seen 3 reports of 3 different groups of researchers developing vaccine, and one person was already injected with active agent, so bypassing animal trials on the permission of FDA. But again, it's still, we project about at least 14 months and potentially a few more months for developing enough of this vaccine for everybody to have it. So it, the best projections I've seen to the time we'll have a vaccine is between 14 to 18 months. Because even though we already injected people, we still have to make sure that vaccine is not deadly, there is no adverse reactions, because we don't want people to be injured or die from the vaccine as well. And plus we'll need a couple of months to produce it in such quantities that will be enough for everybody. So vaccine is still removed in time. Meanwhile, there are many strategies that people look into, so for example, people look into ways to block that entry port for for example, for the virus, this ACE2 receptors, remember I talked about. So if we're able to block that entry port, we potentially can prevent virus from entering the body, right? There are some developments into that. There is another strategy to block the packaging of the virus, that envelope, so it kind of isolated, right? And some antiviral old drugs were repurposed or looked into that, to see whether antiviral drugs can do that. But there is no conclusive, there is many proposals and potentials, but no definitive confirmation that would work. There is also a strategy to kill the infected cells, so that factory, when virus already entered, to identify that cell and kill it. And that we have T cells in our body that do that work. And so the idea would be to activate those T cells to be able to find those infected cells and basically destroy them. So there are many potential avenues to look into that in absence of a vaccine, but there is no potential, no definite treatment yet. That would many potentials. And so in terms of how long pandemic will last, nobody really knows. There are many studies, and I can talk, if you want, I can talk about some important studies, modeling studies, where researchers basically model under different conditions what will happen. And it's important to remember that models are as good as the presumptions that are built on, so some assumptions built into the model may change. So a model is not a definite answer. And also it's important, for example, to remember the fact that when somebody is infected, the virus stays active in the body for 35 to 37 days. So even though you may not have symptoms, symptoms appear, I forgot to say that, I think. So symptoms appear between 3 to 14 days after being infected. So there is a period where you potentially have the virus, but you have no symptoms. But virus is already active in your body and potentially can be spread to others. That's why also, that's one of the difference also we see between SARS and this, because SARS was very easy to identify cases because people would immediately start showing the symptoms. It will be very easy to identify and make sure that we can isolate those people. Unlike with this virus, where it can stay in your body for a much longer time up until you start showing the symptoms. And even after you potentially got over the symptoms, it still stays in the body for 35 to 37 days altogether. And there are questions about reinfection. I've seen reports about that, but there is no definite answer. We don't know whether or not you can be reinfected again. So maybe there is new information I haven't seen, but so far there are multiple reports. Several reports, a few in China, one in Japan, but it's potentially also related to the issue of testing, not reliable testing. So maybe it was not necessarily reinfection. So we cannot answer. Maybe people can be reinfected, maybe not. So yeah, and so one thing I think also important to mention is what I see a lot in response from different people, the way we address the virus, the way we call it, so um, some ways of calling it, like Chinese virus creates a lot of xenophobia in the community. So it will be, in these times, it's very important, I think, to avoid that, to avoid um, identifying specific communities, attributing that, because virus has no nationality. It spreads, again, to 157 countries. And if anybody done a lot in this fight with the virus, it was Chinese researchers and scientists. All that we know about the viruses, we know because of them. The wealth of information they contributed it's amazing. And what is also promising, I for example, I know very well the history of HIV, some other viruses as well, potentially. I haven't seen so much response from scientific community as the response to this virus. I've already seen over 500, it's been 4 days since I've seen over 500 papers, peer-reviewed papers already published. So the productivity, researchers are very active working on this. So that's also promising. So I guess that just covers the basics, but if there are questions.
Sorry, I had to unmute myself for a second. There I am. Yeah, thank you for that. That's a good overview. I really appreciate it. I have some questions, but I'm gonna hold back until there's a lag, and we've already had a couple from Dave that he wanted to ask. And so it's how, first of all, if you can explain the difference between, because we were hearing, you mentioned ventilator, and we're hearing the concern about the medical system being overwhelmed where there's not enough ventilators. And he was just wanting clarification of the difference between a ventilator and a respirator.
It's pretty much the same. We use, I think, these terms interchangeably, but there is also alternative systems, like for somebody who needs oxygenation, but it's not critical. There was ways to use BiPAPs, so oxygen masks and, some other things, but it doesn't address the issue of critically ill people who need a serious support and who need to be basically intubated on respirator, ventilator, you name it. So those we don't have enough.
Okay.
So for example, we only use those, mostly we use those in ICUs. On any given day now, between 85 to 90% of ICU beds are full. So that kind of may tell you that, so then the capacity. We can talk about the study. There was a modeling study that a lot of people talked about from Imperial College of London. It's a study that's also kicked in our government and UK government into action, done by a group of very respected scientists. It's basically the gold standard, I guess, in epidemiology. They inform strategies that same group of WHO response to SARS before, to many other diseases, to swine flu, and if you remember. So basically, everybody looks up to them when it comes to modeling, prediction, and strategies to respond. And so one thing they talk about, they looked into different responses of what will happen if, for example, under different conditions. So basically, one condition will be unmitigated epidemic. It's where we'll basically go about the business as usual. That's how we started here in the US in the beginning, but I don't think it's the case now. So in that unmitigated scenario, the demand for ventilators would be 30 times the number of available ventilators we have in the US. If we switch into mitigation strategies, we put everybody who has symptoms in isolation, family of those who have symptoms also quarantined, and all Americans over 70 social distancing. So it's basically when we talk about flattening the curve, that's what we talk about, right? So still, that cuts the mortality rates, for example, significantly, but the demand for ventilators will be still 8 times higher than what we have now. And only very aggressive measures, they call it suppression strategy, where we isolate all symptomatic cases, quarantine family members, social distancing the whole population, all public gatherings, and most of our places shut down, schools, universities closed. That kind of, very, very strict measures. We will not exceed the number of ventilators available if we'll practice that. So that's a good news, but the death toll will be significantly lower. But there is a catch. If we ever relax those measures before vaccine is available, the disease may come back. So suppression works very well, but up until the vaccine is available, if the virus may very well come back, and we'll have to do it again and again up until vaccine is there.
So there's a real possibility that if we were going to do it, if we were really going to try to keep the rate of infection down, we would maintain some kind of operating at some level between suppression and mitigation until the vaccine is out and widely available.
Right. So what they talk about, it's potential strategy, for example, relaxing, doing severe mitigation and relaxing for a month and going back into like a couple of months, then relaxing. Or even better would be staggering in between the big cities, for example, do it intermittently, between, geographical areas. And so not everybody's doing it at the same time, but, it kind of helps to prevent or suppress. Yeah.
Okay. Another question that Dave had, and let me remind you, the rest of you who are watching right now, if you want to or put in the chat questions that you have for Alex, I'll just try to read them, get them to him. We're doing this also because we're recording this and we're going to be posting it, and the chat feature won't be shown in the recorded video. So I want to make sure I have the audio question out. So as people are watching the recording, they understand where we're going. Dave's other question was related to how long before testing will be widely available. What's the latest you have heard on that? That's basically, it's a swab on the cheek type of test.
Mm-hmm.
Okay.
Yes, it's a swab. Yeah. Yeah, well, the only people who can answer this question will be people who work in government. I've seen the numbers of available testing and how the capacity that who we are able to test. Let me actually just give me a second. I'll try to open it really quickly. What's the latest? So to give you the right numbers from what I've seen. Just a second. I'm sorry. So the expected will be 100,000 per day, what they project by March 27. But the total so far, we are able to test, our testing capacity, it's 36,800, which is definitely not enough. What is promising, different places develop tests on their own. So the capacity increases because, for example, UCLA, their system, they have their own tests, same as Yale, same as Mayo, same as, so there's tests from CDC. that the LabCorp has increasing capacity as much as Quest, so public kind of places. So right now, what I see, LabCorp and Quest is about 5,000 people per day. So, but again, the projection and the hope is by March 27, 100,000 people per day, but we'll see if that happens. So far, I've seen this projection earlier than that. It's still, we're not there yet, and yeah.
Okay. Well, just got a question from Leif. Leif says, how is it that South Korea are far ahead of the US in terms of testing capability? Were they prepared far ahead or what?
Well, my understanding, and that's my understanding, that and still it's debated, that there are tests developed by WHO that some country used and some country would not, and South Korea was one of the countries that's used WHO test, and they were, when we look at also at response of some countries like Hong Kong, Korea, Japan, China, we have to remember they have a really good experience with this from the SARS epidemic. You know, if you see people, you know, I sometimes used to smile when I see people from, you know, from those countries wearing masks, you know, even when there is no epidemic, right? And when you travel somewhere, you see like Asian tourists, right, you know, with masks. And now I understand how much of that cultural memory is still there from SARS, and, you know, because they went through this once, and so they're able to mobilize to, you know, we never had to deal, well, yeah, we never had to deal with something like this before, while they had. And so so that also potentially explains why, but yeah, there are a lot of questions. You know, I haven't seen a really good response as to why we shouldn't be where we are now. Even some European countries are doing much better when it comes to testing. It's not clear why. You know, there is, you know, I think some of the tests that you know, we are producing here in the US.
Okay. Yeah, I had read that too, about the countries having gone through something like that recently was one of the key factors, and that's the hope, obviously, with this, is that this will have an indelible memory for our country that will be much more prepared the next time around, have reserves ready to go. You know, it's kind of like thinking through, like, you know, how we prepared for nuclear holocaust back 50 years, 70 years ago, and starting to think through, all right, this is a much more realistic thing to be ready for.
Yeah, exactly.
And so I'm going to say, Peter, Peter is asking if you can make a comment. All right, Peter, let me unmute you, and I'll let you. Oh no, you're off. Go ahead, Peter.
So yeah, thanks very much for mentioning this, Alex. And actually, in China, we do use masks every day, actually. So it's like, I mean, the government actually require all those citizens, let's say if we go out, so we wear masks every day in all kinds of circumstances. And I mean, even for news conference, any type of news conference, all those professors, or let's say, all those journalists or reporters, they actually wear masks. Here in the US, it's kind of different from here, I mean, from China. So it's like, I mean, the Western philosophy is kind of, I mean, regard mask as something like, if you have disease, you try not to spread it to others, then you wear masks. But I mean, from Eastern philosophy, it's very much like we prevent all kinds of virus, or let's say germs, from coming into our body. So thanks for mentioning this. And actually, I mean, especially I would like to say when we do grocery shoppings these days, if we have masks at hand, still wear that. It's better than nothing, actually, I would like to say. Thanks very much for mentioning.
Yeah, well, definitely. And but one of the things, actually, when it comes to mask now, the problem that's very real now for those who work in healthcare, you know, was the panic that went around, you know, when we realized this threat is very real. masks were absent from any store or anywhere, to the point that healthcare hospitals may lack those masks as well now. So that's one of the reasons if you've probably seen the messaging that, go easy on the masks, is because if anybody needs masks, it's healthcare providers, because if what we know from, for example, from Italy, about 10% of healthcare responders, actually those who got infected, and some of them actually passed. The same in China. You've probably seen, the first whistleblower, the first doctor who reported the virus and issues related to the virus, he died. And so if we have to protect anybody, and anybody needs to wear a mask, that will be healthcare professionals. But unfortunately, aside from ventilators or respirators, the other critical deficiency in supply would be masks and protective devices, so N95s, or even any kind of mask. Up to the point I've seen, and I know people resort to things like doing their mask on their own, because it's the exposure is real there.
Yeah. So I have a question, because it's actually completely related to, it's very selfish. It's what I'm dealing with in my own family at the moment. And then I have another question after that. Right now in my home, 2 of my daughters have some cold, some kind of, one has a cough that's been lasting now for about 5 days, and the other has a sinus infection, is on antibiotics.
Mm-hmm.
Because I'm not a doctor, I'm not going to assume that I know what they have, and that I'm not going to rule out that it's COVID-19, even though it may not be. What is my responsibility to the public as a family member who has it in my house, as far as should family members who I don't have any symptoms of my own, do I self-quarantine? Because like you said, there's no way to know if I have it for many days, because symptoms will take a while to. So what is, in a situation like that, when you have family members in your home who are ill with something, what's the right public health behavior to take?
The right behavior will be to self-quarantine, and potentially limit the if possible, the contact, physical contact, right, if possible, for a time, and use a lot of chlorine or anything you have, even soap, but chlorine is better, right? Or
Bleach.
Bleach. I mean, the bleach. Anything you can to clean the surfaces. If you usually the self-quarantine is about 2 weeks. That's what they recommend. So basically, but self-quarantine, it's just try and avoid any potential contact with anybody who, because the other interesting thing that's there was recent research that's showing that a lot of cases may also go undiagnosed, even like with very mild and no symptoms, but at the same time, it still, potentially can be contagious. So even though you may not, some people have strong immune system, right? So the reason why this virus spreads so fast, because there are a lot of cases in the community who may not necessarily develop symptoms at all, but they still potentially will be carriers, so, and the virus by itself will infections. So self-quarantine is potentially will be the best option. You can call in and see if if we can get tests, because we ramping up capacity, and here, for example, any UCLA clinic may have it. You can call Quest or the LabCorp, any of those. California public health labs may have it. So public health departments have their clinics.
Right.
and they also may have tests. So, but what I would suggest strongly before you go anywhere, call and make sure that they actually have it, because you really want to minimize any kind of contact with healthcare institutions. So if there is a way to avoid being there, because maybe it will be not dangerous for you, but being a caterer, you may expose others to danger. So so if you're planning to go and get tested, which maybe not a bad idea, but please call ahead and make sure that you can actually get it, and so your trip will not be in vain, and minimize any time of any kind of exposure.
Okay. All right. Leif has a question. He says, with the mitigation measures that we've taken, and in our context, of course, our congregation, our campus is closed. We don't have any gatherings taking place at all. How long, and I know nobody's giving out an answer, but in this trying to mitigate things, do you see churches and schools being shut down for like at least the next 2 months? Or are you thinking, I mean, we're not going to hold you to your prediction, but based on what your sense is at this point?
Well, what I've seen, what I've seen from the government as well, what has been told, I think it's about, a month, but, a month meaning till May. But yeah, it's difficult to predict. And again, remembering the reality of modeling study I mentioned, we may go in and out, or up until the vaccine is developed, some sort of measures like this will be needed in some form. So it's difficult to say, as long as much as I want to be optimistic, it feels like this potentially can last longer than we would hope or anticipate.
Mm-hmm. Peter, you had one more comment you wanted to make. Go ahead.
Oh, you muted.
So can my voice be heard?
Yes.
Mm-hmm.
Okay. So from the example of China. So actually, the Seventh-day Adventist Church in Shanghai, all over China, actually, they started, doing quarantine and stop all kinds of church services. Around, I would like to say, let me see, it's around January the 21st. So, and now, it's kind of like March, the middle of March, March the 18th. So it's almost become like, 2 months and a half now. And the discharge rate of coronavirus patients in China reached almost 70%. But the government till now actually still didn't, release any kind of announcement saying we can do public gathering now. So I would like to say kind of, maybe for the US might be at least, I would like to say around 3 months, I guess. So it's just, I guess.
Mm-hmm.
So thank you.
And again, China have done an amazing job. I don't think we ever going to do what China was able to do in terms of testing, in terms of very strict quarantine right away, in terms of, our response may not be as thorough and as great as theirs.
Yeah, I guess around 3 months. It's just my personal guess. So yeah, from my experience in China there. So anyway.
Yeah. Thank you. Any other questions from those of you who are online? Any other questions for Alex that he can answer? Alex, I think you may have said this in your opening comments. Forgive me if I'm forgetting. That the original idea of this isn't transmitted through the air, that's not completely correct, because even though it's moisture or some kind, it can live in the, so saying that you can't breathe it in is not completely true. You could breathe it in if and that's why the social distancing is so important.
Right. So it only can be airborne when it's pulverized, basically aerosoled. So one of the issues with aerosol, and that's why we worried so much about healthcare professionals, because air there is aerosoled, and ventilation actually does spew out stuff, like when somebody's on a ventilator, right, or respirator, right? So one of the potential, like one of the great examples in why we're so concerned about protecting healthcare workers, because in their case, when they interact with somebody, say on respirator, or ventilator, who obviously has symptoms and sick, that kind of air, they put them in danger when virus actually is kind of airborne, right? Same happens, when people, for example, outside sneeze and, don't sneeze into their elbow, or, into something that also makes the virus airborne. So there is a potential. It's not ruled out, but it's only when virus gets airborne. It's not naturally found in the air, only when there is a way to make it airborne. And then it probably can hang in the air for a while. That's one of the other reasons why social distancing is so important.
Okay, thank you. Any other questions or anything we else want to ask Alex before we wrap up for tonight?
Well, I put some links I gave taught, so maybe I can tell. So the first one is from Johns Hopkins, and it's just a tracker that shows number of infections worldwide, number of infections in the US. So if you want up-to-date information, updated regularly, you can go on that map. It will give you all the cases. There are a few other trackers. I think this just more reputable, but obviously, if something that needs to be mentioned, please follow CDC and WHO for the latest information. That's the two verified sources we need to follow. From just practical perspective, from what I've seen, I really liked, I recommended this, it's Kevin MD blog, but it's written by healthcare professionals. And it's just written in a very simple language, some practical recommendations, some practical advices. So that's just something I remember. There is so much information going on now. And I think it's important, first of all, to double check the source, not to repost things that are not supported by either studies or by CDC, WHO, or or from the source that you cannot verify or know with the veracity of the source. So the two sources where we should always check and look for the information, CDC and WHO, and for the numbers and data, you can always check Johns Hopkins, and I think they also have some good information aside from the numbers as well.
And so what I'll do is when we wrap up here, I'll keep the video stream going for about 5 more minutes, so you can, if you haven't already, just copied and pasted these links off the chat section. And then for those watching on the recording, I'll have these links posted down in the comments section below, so you can click on the links there as well. All right, I think the questions that wanted to be asked have been asked. And so Alex, thank you so much for taking this time, and I just really appreciate just knowing somebody who you can get good information from, and so we really appreciate it.
Yeah, so if there are, I think, again, so just to emphasize, if anything to emphasize will be the importance of social distancing, in terms of, flattening the curve. I'm sure you've heard it, but the idea is, instead of what I mentioned in the modeling study, instead of having the spike of infection all at once, what we're trying to do is to stagger it and reduce the number of infection and prolong, so we would be able to respond. And that's the reason why we have these very severe measures, and that's the reason why we implore everybody to stay home, to practice social distancing, to avoid any kind of unneeded trips, unneeded gatherings, unneeded interactions outside. So, practice 6 feet between people, wash your hands, sanitize your hands if you have them, sanitize the surfaces. So because by doing so, we'll potentially be able to reduce the number of infections and be able to respond, avoiding that kind of Costco situation, but in healthcare, where, we'll be one, and you've probably seen that happens in Italy as well, where doctors had to just basically decide who gets ventilator or not, because there's only a limited number of ventilators and a lot of people who need them. So we really, really want to avoid that, and that's the reason why we trying to remind everybody about flattening the curve and doing all these precautionary measures.
It's really, I mean, to put on your Christian ethics hat, this is the call of churches and faith communities around. Is our responsibility is to live up to loving one another as we would love ourselves.
Right.
So that type of advice is right in the spirit of any good faith tradition.
Yes, exactly.
So, well, thank you again, Alex, for that. And then for those of you who are watching this, I just want to remind you, keep watching our website and our social media pages for different online events that we're going to try to have to not distract you, but hopefully give you meaningful information, meaningful spiritual community support during this time. Tomorrow night at 7 o'clock Pacific, we're going to have an online prayer meeting and Bible study, and just an opportunity to be in community through the same Zoom video conferencing that we did tonight. But everybody will be, their mics will be up and we'll be talking and praying together. And then on Saturday morning, our worships at 11 o'clock Pacific time will be on the Glendale City Church YouTube channel. Anyway, hope everyone is well, stays well, take care of your family, live up to the ideals of your faith as we get through this thing together in the weeks ahead. Have a great night.
All right. Thank you.
Thanks, Alex.